Welcome to United We Spay, the show dedicated to promoting affordable spay-neuter services nationwide. Each episode delves into the heart of the movement, sharing inspiring stories and driving positive change. Our goal is to raise awareness, educate, and empower, addressing overpopulation's root causes to ensure every animal has a chance for a better life. Hosted by Stacy LeBaron and the United Spay Alliance team, we're on a mission to change lives. Fed up with the fixation on symptoms in the animal welfare conversation, it's time to change the narrative. Join us on United We Spay, where we make a difference by spreading knowledge and building a compassionate world for animals. Let's put prevention first and spotlight spay-neuter in the animal welfare space.
You're listening to United We Spay, a podcast from United Spay Alliance. United Spay Alliance works to promote accessible, affordable, and timely spay-neuter services. Because an ounce of prevention today can prevent untold suffering tomorrow. Spay-neuter. It's public health for pets. I'm Stacy LeBaron, United Spay Alliance board member and host of the show. And today on United We Spay, we are talking to Will Zweigart. Will is a former advertising executive turned nonprofit leader with a deep passion for solving the overcrowded animal shelter crisis in New York City and beyond. He founded Flatbush Cats in 2018 as a TNR and rescue volunteer, but soon realized we cannot rescue or adopt our way out of this crisis. In 2023, Flatbush Cats opened their first nonprofit veterinary clinic called Flatbush Vet, which provides affordable, high-volume spay, neuter, and wellness care to pet owners and rescuers who could not otherwise afford to see a vet. Welcome to the show.
Thank you, Stacy. Excited to be here.
So first and foremost, we talked a little bit about it in your bio, but really, how'd you get to be so passionate about spaying and neutering cats?
Because I want to solve this problem.
So expanding on that, though, how'd you discover that you could not adopt your way out of it? I feel like there are still so many people who believe that they can rescue cats, build sanctuaries. What was the turning point that made you look in a different direction?
We started rescuing and doing trap, neuter, return in a pretty tightly focused area, a few blocks, mainly because that was our capacity. There were several dozen cats at any given time that needed help there. And, it's kind of just watching that play out, those exact blocks 6+ years later have new cats popping up. And it's like a punch in the gut, for every rescuer or TNR volunteer who's really, thought they had sort of done the full cleanup. They had gotten 100% of their colony cats spayed or neutered. They had rescued all the friendlies. And, the reality that I'm not sure many folks are ready to accept yet is that you can do all of those things and new cats will show up because the pet owners on that block, for a variety of reasons, either did not have access to veterinary care or did not know the importance of veterinary care, or again, a number of different factors. So if you don't get to the root of that, you're always going to be doing cleanup. I think we talked about the analogy of scooping water out of the basement. Access to veterinary care is how you go upstairs and turn the sink off. And I really want to see a specific part of Brooklyn reaching sort of a solution point where, and by surveying residents and neighbors on that block, asking them, do you have affordable access to veterinary care? Do you know where to go to get care for your cats and your dogs? And I want to see that answer rise year over year. And that's, I have a lot of empathy and understanding for folks who believe that, expanding their own capacity to doing something like spay or neuter might be out of their reach. So I think sometimes we tend to, for our own protection, we tend to focus on the things that we believe we are capable of doing. We tend to keep blinders on, but it's not really helping us because, as volunteers, rescuers, like you are eventually going to burn out. You are eventually at some point, for some reason, you're not going to be able to care for the cats on that block. Could be age, could be finances, could be life events. And I think it's better to have the hard and uncomfortable conversation up front about what is really necessary to help all of these cats and the ones who may show up a few years later, It's better to have that hard conversation up front, even if we don't have all the answers. At least we're really talking about what needs to be done.
So, I mean, in New York City, there's been a history of having a lot of resources going in, citywide. There used to be the Mayor's Alliance. Maddie's Fund had put a lot of money into supporting the city. ASPCA used to have mobile spay-neuter clinics. And you started your group in 2018. So I think you might have missed that sort of exciting period of time for access to care in New York City. You kind of entered the game just as things were starting to shut down, tighten up. And, at somewhere along the line, you said, well, I'm going to just open a vet clinic. How did that happen? And why did you believe you could do that? You're not a veterinarian.
Yeah, you need a little bit of naivete and you need a little bit of just relentless drive to push through the barriers that you're going to run into on a journey like that. And I think we'll talk a little bit more about New York City later, but it's an issue of scale. It's an issue of proportionality. Pouring, some resources into a problem this big is great, but there's a saturation point. If you don't hit that, you're not going to see meaningful change. We can define meaningful change in a number of ways. One would be, again, do residents know where to get help? Another would be looking at intake numbers for shelter, but I think everyone listening to this podcast knows that that's the tip of the iceberg, and there are a lot of uncounted scenarios outside of those metrics, even though they're very important. And so I think any nonprofit has to go back to their mission. What is your purpose? Why do you exist? Structurally, nonprofits exist to fill the gaps that municipalities and, for example, private interests are not able to meet. That gap is very clear. And so we just had to ask ourselves honestly, if our goal is to reduce, the outdoor cat population in Brooklyn and beyond, if our goal is eventually to reduce overcrowded animal shelters in New York City, what do we actually need to do to make that happen? Because again, the reality is that rescuing and adopting cats, even TNR, those are all reactive activities. All of those begin with a cat needing help. And I think these animals deserve our attention upstream so that we can actually prevent them from ever being in a position where they are relying on a volunteer to help them. Because help doesn't always come, if we're being honest. And so it was a very difficult multi-year process to evaluate how a nonprofit could develop the organizational capacity required to add veterinary care as a program, as a service. You and I had a conversation about this years ago, and I was like, Stacey, I think from some of the stuff you're sharing, it seems like there is a potential path to financial sustainability for a clinic, because my biggest concern was obviously the resources required to not just build a clinic, but to maintain one. A lot of the traditional models that we see revolve around spay-neuter and other preventative care being free. And I think, one of the more interesting discussions is actually accessibility and affordability is the key, both from a pet owner standpoint, because they want to have the dignity of being able to care for their pet. They just want a fair shot. And from the nonprofit standpoint, because we can't, create a new program that requires millions of dollars of funding every year. And if we don't get it, we shut down. That's not a good way to operate. So I'm happy to talk more about that process, but I had to look inward and first understand what skills and qualifications I needed to develop personally as a leader. At that time, I was a volunteer. I was working in sort of corporate advertising, because in order to develop the organizational capacity to run a clinic, you've got to learn how to manage people. You've got to learn how to marshal resources. And a lot of people are not capable of raising the dollars to open a clinic. I would like to see more attention around what happened to all the spay-neuter grants? What happened to all the capital grants? Like when I talk to people, because folks reach out and ask for guidance, and I have to be the one to tell them because they assume they're going to get a grant to open a clinic. And I'm like, they don't exist anymore.
Right.
They don't.
Yeah. No, they're very hard to come by. And the days of having those types of programs in place are not that prevalent anymore. During the pandemic, I think we lost almost 50% of clinics that had started up. So we lost a significant amount of capacity. With that being said, tell us a little bit about the crisis in New York City. My memories of it before 2019 was, it was a city that was really trying to address the situation, the cat overpopulation problem. They had some large support, maybe at the city level, also support of larger organizations. But I am not boots on the ground. And so, what has evolved for New York City? And maybe it's an example of how easy it is to lose your traction on the overpopulation situation. What's happened, over the last 6 or 7 years in New York City?
Yeah, it's a great question. And that was really the first step, is researching what are the current needs, what are the current other players. ASPCA has been and is still the largest provider of spay-neuter services in New York City. So I began chatting with them. They have a strategy and research team, and so they were able to share some data with me around the need. We honestly didn't need to spend that much time on the needs analysis because it's just insane. So got a little bit of data, but didn't let that hold us back. The need at the time was estimated to be over 200,000 additional affordable spay-neuter appointments are needed per year. Checked in with them recently, and the feeling is that is still the case. A bare minimum would be 100,000, and that would only hit pet owners with, on the lower to lowest average household income. So it wouldn't even hit everyone. And so I would go back to scale. There are some resources, nowhere near the level of resources needed to turn the tide, hit a saturation point, whatever analogy you want to use. We're not even paying off the interest on this debt right now. I think folks listening to this understand some of the macro factors around the veterinary shortage, around the backlog from COVID. But I'm now starting to look more critically at the municipality itself, New York City, how it funds animal welfare, where those dollars go, how much money we spend per capita versus other cities who have turned this around. And not that I think city funding is going to be a magical solve here, but given the scale of the problem and the scale of the resources needed to solve the problem, they are going to have to be at the table, and they are going to have to be contributing 7-8 figures a year before we are even on the trajectory to solving this. Because while I'm very thrilled that Flatbush Cats was able to, marshal the resources to build and operate one clinic, we do not have the capacity to repeat that 10 times over or 100 times over ourselves right now. So I guess the short answer is you have not enough participation from the large animal welfare organizations. I think I would maybe assume that it's not a strategic priority for them. They can answer that better than I can. Not a priority for the city. We had a sort of a milestone and a step forward recently with a city council oversight hearing that took place in September 2024. But that was really just the beginning. That was the first time that hearing has ever happened. It was the first time animal welfare advocates and volunteers got a chance to share their pain points. Most of those hearings are traditionally just focused on the shelter. And one of the things that we're talking about to anyone who will listen is, why are we expecting the shelter, the safety net, why are we expecting them to solve this problem? They only get involved when it's the worst day of that pet owner's life. That's not an upstream investment. That's not a strategic investment. And so we're working to draw attention to the problem first. And I expect that we will have a 5-10 plus year journey ahead of us, even just to marshal the correct level of resources across both public and private investments.
So if New York City got the appropriate funding, has anybody done any forecasting to see sort of how that translates into per capita expenses? Because I did watch part of that city council hearing, and the figures were pretty staggering between Miami and LA and New York. And so, if New York did bring it up to an appropriate level, is that enough funding, or is that even at that comparable level, not enough funding to move the needle in the direction you're talking.
I think that is the approach. And I think it would, this is going to happen in steps, right? And I think meeting the bare minimum requirements could be measured by our per capita spend because it would take into account the size of the city. It's really hard to benchmark our problem because Brooklyn alone is larger than those most other cities in the country. So yeah, I do think a per capita spending reference would be helpful. I think that's also a good framing for national discussion because regardless of where you are, you have a frame of reference.
Yeah. I mean, is that a good metric for us when we are looking at comparing successful communities or, model communities? When we look at a model community, is their per capita expenditures higher than others? Or is it just that, or are they doing something else? So what's the special sauce that the more successful areas of the country are, doing the good work to help elevate the status of animals, help access to care, affordability, all of those things, those models, it's, try to get those as examples and we can look at them and see, how did they create this and what can be replicated depending on the different needs and structures of, a Brooklyn is different than rural Tennessee. And so there are going to be adjustments, but, are there some metrics that remain constant throughout? I think that's a very interesting strategic question.
Yeah. And just to dive into that one level deeper, not just how much are you spending, but what are you spending it on? So, I'd love to see breakouts. And I do have a little bit of a chip on my shoulder because we're a very small organization. We are less than 100 the size of some of the largest animal welfare organizations in the country. So I find it interesting that we are doing this strategy and research work, without the resources to do it. But with that aside, I would like to see a breakdown of, within total spending, how much is for reactive efforts like sheltering. I'm very sensitive here in these conversations because I don't want our shelter colleagues to think that we are advocating for them to receive less money. We're asking for the total pie to be larger. And so I want to see, an incremental and then a seismic shift on upstream spending. And I want to see that broken out separately. That could be, for example, as simple as how much are you spending on access to care? So using some, again, common frameworks, spay-neuter, affordable spay-neuter surgeries. And then how much are you spending on things that are not veterinary care, but you could bucket under surrender prevention? So that's anything else you're doing. Are you working to make housing more flexible for pet owners? Are you working to, offer short-term solutions to keep folks from having to have that surrender conversation? Let's get to a point as a sector where we have that data and we can then have those conversations.
Yeah, one thing I would say too is that you've developed Flatbush Vet, and many organizations are doing different types of models, and then I think it's sort of a testing ground, and then sometimes those models are picked up. You said you cannot do more of these clinics, but maybe you can create a model that others can repeat in other parts of the country. So is that what you envision, with Flatbush Vet? Are you envisioning that? Is it a successful model? I mean, we all learning lessons doesn't always mean it's rosy at the end of the road too. So is it a successful model? Is it something that can be replicated? And maybe at some point in time, maybe a larger organization will build 10 of them.
Yeah. Yes and yes. So it is a successful model, and I can talk about that a little bit more. And it's not innovative. We built this based on listening to your podcasts and by listening to, going to these conferences and hearing from others. Like, we went into this with the confidence that we weren't doing anything innovative. We were just bringing smart solutions that work to an area that didn't have it. And so we'd absolutely love to package up what we're learning and share it, because I think, given that we're in a very, very dense urban environment, we're in one of the densest zip codes in the country, folks need to be able to look at different menu options for what their clinic might look like in terms of size and capacity and services. But by the time this podcast airs, we will be break even in terms of like monthly cost recovery. we had a 2-year target and we will meet or exceed that target. So within 2 years of opening, the clinic should be able to pay for itself on a monthly basis. Our prices are a little bit higher than what you typically hear about, in this sector, but it's also, again, a more expensive market. That includes being able to compensate and retain an all-star team. And so we would love to share what we can. And we are going to be scaling. I just wanted to highlight that we can't build 10 clinics in 2026, by ourselves. We can build more clinics and we will do that. But I think the other thing we'd like to do is send trained surgeons out to the other parts of New York. So we'll be looking at expanding our training capacity, because you can't, even if you had the funding to open 10 clinics, you don't have the staff. So we're working upstream on that level as well. So I think our future is both expanding our own footprint in terms of capacity and then helping other partners either in the broader New York City area or across the country learn anything that we learned the hard way so that they can, learn from our mistakes.
If someone was interested in starting an initiative like what you're talking about, starting a clinic up, but they are also a CPA or a marketing person or someone that they feel like they just have no right thinking that they can start a veterinary practice, what would you say to them?
I would ask how hard they are. How hard are you willing to work? Because, I'm not a vet and I opened a vet clinic, but it was really hard because I had a massive learning curve that was very time sensitive. Once you sign a lease and once you begin to hire staff, you are burning cash until the day that you open. And then you're going to burn cash for, another 6 to 12 months until you figure out how to actually operate that clinic. So there are a couple shortcuts you could take. You can learn as much as you possibly can before you begin to make these commitments. You can think, one of my favorite books is called Who, Not How. So you can think about what collaborators am I going to bring on board, because trying to do this yourself is impossible. So you would need to be incredibly resourceful, I think, both in terms of how you pull together a team and, again, how you marshal these resources. The quickest question I can ask is, are you able to raise the money needed to open this clinic? Because when people reach out and I say, where are you in the process? They haven't even begun to think about how they're going to raise hundreds of thousands, if not millions of dollars. And so start there. If you think you can tackle that, if you can climb that mountain, if you can manage people, if you can find and build the right team, if you can put in the work, because that was a incredibly challenging several years, then why not? But I do want folks to have an honest assessment of the mountain they would be climbing.
Right. Well, and again, I think one of the lessons learned is we want to invest in businesses that are going to be sustainable, self-sustaining, and we have a business model that works, on a long-term basis and that can weather the storm or the pandemic or whatever that comes by. We're prepared to create support for the community, whatever might be thrown the community's way, as well as our own. I mean, thinking, about disasters and all of these other scenarios. And I think as a business, we need to try and make sure we're going to create something that will be there to support the animals, cats and dogs in the community. So I think it's great what you're doing. I do think it's also wonderful to just say, we need this. And no one else seems to be doing it. And we have to do it. And we have to use a focused area. You have a target area. You're working on measuring your impacts there. And I just truly think it's a phenomenal model. If there were any specific takeaways that you would like to share with our listeners today, what would it be?
I think it's important, again, to go back to what your mission is, what your goal is, why you exist, and be prepared to have the hard and honest conversations about what you believe will actually be necessary to achieve that goal. I tell our team it's fine to raise up a problem. It's fine to call out an issue or a barrier. You don't have to have a solution for it right away. But if you're not honestly talking about what really needs to happen, there's no way you're ever going to solve that goal. And so that often does require you to think big and articulate a big vision and a big goal. And it was very heartening to see folks come behind our side and get in our corner when we put ourselves out there and we were vulnerable and we said, look, we're going to figure this out. We got to do it. And that's how you attract support is put yourself out there and lead. The confidence to do this stuff, that comes later. You don't have the confidence when you start. You earn the confidence by doing the hard things, even when you're terrified. So I think that might also force you to have bigger discussions about collaborations, right? Okay, we got to have some more spay-neuter services in this area. What is that going to look like? Maybe we are only a part of that mix. But I really want to get folks off the treadmill of thinking that, we can only work in a linear fashion. We can only do what we've always done. It's not working. And that's not a slight to everyone's efforts. I think if we really recognize everyone's efforts, we should be working towards a different solution. I want folks who are giving so much time and effort to this to be able to enjoy their lives. I want them to be able to take breaks. And, that only happens when you're working with a team and when you're doing things that are high leverage. I also want to note that this is really not just a spay-neuter conversation, because when you launch spay-neuter services and you start to engage with clients, because we're seeing about 70% pet owners by design. So we have over 500 rescuers who have signed up for discounted services in New York City, but the bulk of our services go to pet owners. And I just want to give folks a heads up that when you meet with those folks and you engage with them, you're going to find that they need a whole lot more than just spay-neuter. And so we have a wellness team. And I say that because surrender prevention, as I'm learning, is multifaceted. And spay-neuter is certainly going to be the core of what we do, because I think it's one of the highest leverage services that you can offer. But it takes a lot of different types of community engagement and support to truly keep those pets with their family and out of shelters.
I think there's different phased options in there too. We often, in the trap, neuter, return space, we talk about front loading, big spay neuter, mass trapping, all of that. There's an evolution within the community and what their needs are. And where the spay neuter is so effective at stopping the overpopulation, especially in cats. But then over a period of time, when you hit a certain level, there's going to be other services that the community needs and that those animals need, because you've committed to putting resources into them at a young age, ideally for spay neuter. But then down the line, you are still their primary vet and they're going to come back to you. And we don't want suffering out there. So if that's part of your mission, which most organizations would have that, I think your vet practice needs to have some fluidity. It's not like we do 10,000 surgeries this year and every year. It may go up and down depending on what you have going on in that community. Would you agree with that?
Absolutely. And I think it depends on what your current level of resources are in that community. If you can tell that there's a huge gap for spay neuter and that's what you're able to provide, that's great. We all have to look at this as an ecosystem. And so what other partners are going to be able to provide complementary services? We might not be the best partner to, provide temporary foster homes for folks who need that, but maybe we can connect our neighbors with a different org. And so you really have to think about a partner and ecosystem-based approach to get anything meaningful done within a city.
Will, you have a phenomenal social media presence. And so if folks are interested in finding out more about Flatbush Vet, how would they do that?
Yeah, I would say you can look us up on any platform just through Flatbush Cats. We are kind of documenting our journey to move from rescue and TNR, which we still do a ton of. We do more rescue and TNR, every year than the previous year, but we're kind of including veterinary care and Flatbush Vet and all of that stuff in those accounts. So you can find us at Flatbush Cats. If you want to poke around and see what our vet clinic looks like, that is called Flatbush Veterinary Clinic. You can see that as well.
Excellent. Well, thank you so much for being a guest on the show. And folks, thank you for listening. If you liked this episode, be sure to share and subscribe. We'll be releasing a new episode each month, digging into important conversations surrounding spay-neuter throughout the U.S. and around the world. For more resources for spay-neuter and learn more about our work, it's at unitedspayalliance.org. That's unitedspayalliance.org. And if you'd ever like to get in touch with us directly, just email info@unitedspayalliance.org. Until next time.